in this case, I wish to mention that the chief guest for the evening, our founder president of Tumbe Group and the founder president board of governors of the Gulf Medical University, has just conveyed that he is not in a position to be with us this evening for certain unexpected developments. Some other assignment has come up, but however, he has extended his best wishes to each one of you, and especially to the GMC Hospital Fujarah team, who have put in a lot of efforts to make this Doctors Meet 2013 a success. Similarly, Mr. Akbar Moideen Tumbe, the Director Healthcare Operations, also got held up, which is just a coincidence. We will be missing his presence this evening, but he also has extended his best wishes for the function. Saying this, may I request Dr. Dinesh to please come on stage and propose
Doctors Meet 2013 at GMC Hospital Fujairah. At the outset, I have to mention the two names who are not present right now, but without that hospital will be complete. First and foremost, President Mr. Tumbe Moideen. Without his blessings and support, probably this would not have been possible. Secondly, Mr. Akbar Moideen is our director, and he has been instrumental in the phenomenal growth of this hospital in recent years. Then, I would like to welcome a great strategic manager who knows how to get the best out of us. Our beloved Dr. Manvir Singh is the medical director of GMC Hospitals. Welcome, sir. I would also like to welcome Dr. P.K. Menon. He is the Director of Administration and the Head of Institutional Research. Welcome, sir. And then our beloved, he is the pillar of strength for us and the backbone of GMC Hospital Fujairah, Dr. C.R. Satyanarayan. Welcome, sir. And last but not the least, I would like to welcome all of you, my colleagues and esteemed guests. All of you are welcome. Please enjoy the evening and please help us to make this occasion a memorable one. Thank you. Welcome.
First topic. First topic is on orthopedics. It's arthroscope, principles and its role in orthopedic surgeries by Dr. Mohammad Zakir. He is our orthopedic surgeon. He has a fellowship in orthopedic and sports medicine. A brief about him: he is a graduate from Mysore Medical College and completed MS Artho from Karnataka Institute of Medical Sciences, Hubli, in 2003. He did his fellowship in sports medicine and arthroscopy from Singapore General Hospital, Singapore in 2011. Before coming here, he was working in Saudi Arabia for 4 years. I welcome Dr. Zakir to present this topic.
So starting, let me introduce what is arthroscope. So arthro means joint and scoping means to look. So literally it means we are looking into the joint. So it's like looking into a room through a window instead of going and opening the door and entering inside. So it's a minimal invasive procedure which is very popular nowadays. So our old professor used to say, big surgeons make big incisions, but that has changed now. So and this person over here is the one at present, and which are the joints which can be scoped. So any joint, any major, these are the other instruments, and there are, so what are the indications of, so the knee joint, the first hand, and then in patient meniscectomy and meniscal repair, and not younger patients with osteochondritis dissecans, scopic lavage and chondroplasty. And so in this shoulder dislocation, we use the soft tissue commonly done nowadays, which is prevent the impingement syndrome. So other joints, it's mainly unexplained hip pain, can be done through the arthroscope along with contraindications being the ankylosis of the incisions. I can show you, this is the anteromedial portal which we use in the knee joint. Once we connect it, then we have a view over here. This is the tape screen, you can have a view of the inside of the joint. This is the retina, the undersurface of the retina. So first thing first, we have to do the pathology of it. So
for diagnostics, its role in human disease detection and prognostication. It will be presented by Dr. P.K. Menon. He is our Director, Administration and Institutional Research, Gulf Medical University, Ajman. He is basically a army man. He did it MBBS from AFMC Pune. He did an MD from AFMC Pune. And he worked there for 22 years. And then he has a UCLA Fujarah postdoctoral AIDS International Training and Research Program at UCLA Los Angeles, California. He has the experience of running a hospital pathology lab since 1990. I welcome Dr. P.K.
Of DNA. This cycle of heating and cooling is repeated, and by the end of 30 cycles you get about a couple of million copies of DNA, and that is what is now detected using a gel which looks something like this. Now this are very difficult. It's very difficult in babies to take a blood sample in case you want to detect septicemia. So what we did was we took a blood sample, we put it up for PCR, and what you're seeing here is molecular weight markers. These are 100 base pair difference between each. And this is the sample which has amplified the DNA fragment, which is common to all bacteria. This is an 861 base pair fragment, and this, lo and behold, we were able to slip. And next day in the morning, this FMP gene shows that gastric cancers very difficult to diagnose in laboratory, and we did something called DNA fingerprinting. This DNA fingerprinting resulted, which is very specific for whether the donor and the mutations are another area, iron load and disease. And you can see this is one human genome or within bacteria. You can see whether it's adenine, guanine, cytosine or infections. Another use which is now coming up more and more often. See here is the fusion of the red end of chromosome number 9 of a patient as the person reaches the level of undetectable transcripts. This is a beautiful example of ambivalent. So it's called SCI or spectral calculation,
which is a proton pump inhibitor. So just 5-minute video. I would be grateful if you just pay attention. Okay?
Every proton pump inhibitor is a secretory canaliculi of the gastric parietal cells. These secretory canaliculi are filled with acid. The prodrug exposed to strong acid is protonated and undergoes a conformational change. Residues are attainable from the side of the acid accumulating lumen. Then gastric acid secretion is inhibited. Have no cysteine residues on their acid accumulating side in several other commercially available proton pump inhibitors. However, they are not earned minimal pH values for conversion from a prodrug to active form. Secretion. This with a pH of 1. Sufficient number of active forms in the secretion.
Which is a proton pump inhibitor called Pariet here. It's now known as the fastest proton pump inhibitor and also the safest proton pump inhibitor, as it have non-enzymic metabolism, so it can be safe with other drugs. And Pariet can be taken before or after food in the treatment of gastritis like erosive GERD or non-erosive GERD, H. pylori, just once daily, 20 milligram before or after the food for a long period like 4 weeks to 8 weeks. It depends on each disease. And that's it. Thank you.
Assalamu alaikum. At the very onset, I'd like to thank the management of GMC Hospital to give me this opportunity to make this small presentation to you. Now, this presentation offers title as Role of Certain Physicians in Diabetic Retinopathy and Glaucoma. This is applicable to all of you. I've met many doctors here. Many of them are radiologists, orthopedics, internal medicine, gynecologic patient who complains that he's seeing some flies in his field of vision. How much do you feel that this patient needs to see by your diabetes? The most common being the cataract, or the vitreous hemorrhage. The role of diabetes. The risk of patient having a diabetic retinopathy, and most of them is undetected. We need to catch these patients early. And we also have a camera. We also do a procedure what we know as optical coherence tomography, which we use to diagnose the Ministry of Health of United Arab Emirates. The aim of this is to take these images, and if required by increase intraocular pressure, the fundus photogram showing you and also the visual field defects in form of scotomas, the most
of nasal foreign bodies depend on careful examination of the nasal cavity and its adjacent structures. Medical personnel skilled in the technique of removal of nasal foreign body should be involved from the outset. Due to lack of cooperation of the patient and occasional difficulty in extraction, 90% is from the little area, that is the anastomosis, the site of bleeding, and 10% of anterior nasal packing, nasal specialty is because of the sharp acute sinusitis and very successfully treated with quite a broad spectrum antibiotics, but there is some osteomyelitis. In orbital it can be a preseptal or periorbital cellulitis, postseptal or orbital cellulitis, and in osteomyelitis of the frontal bone, the POTS, puffy tumor. You can see this is the periorbital sinus thrombosis, again cavernous sinus, and teamwork comprising the EN and heparinization for cavernous sinus is anterior to the prevertebral space and palate leading to formation of abscess. The pus is located middle and uvula. There is dysphagia. The treatment is antibiotics in the larynx. It's an emergency. Muffled voice and the patient relieving the airway obstruction and then step down with it.
Not kinolones only. Compared to coaxiglab and cytophemic steel and clarithromycin, we have also the lowest MIC90, so you can start direct with fluoroquinolone groups, and this is the guidelines for the levofloxacin. The clinical trials in bacterial bronchitis, we are comparing. It's published in Current Medical Research and Opinion 2006, also in Modern Medicine October. We are 6% recurrence and they are 9% for 5. So this efficacy, we are effective there. So conclusion, cytosine, oxalic, labinamic acid, and levofloxacin all the same. The numbers is given also indication that we are not far from the 64 million patients. Also, amyloxy and this is the most common mechanism.
Polymenorrhea. If the cycle, bleeding during cycle is less than 5 ml, we call it light cycles, and if it's according to this image from Williams, we can train them to give points to them, to their actually pads or tampons, or if the patient is bleeding more than 80 ml per cycle. Or we can ask the patient to write down reproductive patients, perimenopausal and menopausal are being born. And that is because of withdrawal of maternal and hymen, in order to see if there is any evidence of vulvovaginitis level. After pushing too much, the child can develop second difference. We consider the infection in mid-cycle, that's implantation bleeding. That is like hypothyroidism group. Again, anovulatory cycles come to the first differential. This is because of disturbance in hypothalamic. In postmenopausal patients, the prognostic come with a relapse. what kind of also keep in mind that there is a possibility of discharging or using it after.
Finalizing this and setting the coupons in order, I'd request the Medical Director, Healthcare of Tumbe Group, Dr. Manveer Singh Walia, who will be briefing you about the latest developments and the additions into the group of GMC hospitals. Ladies and gentlemen, I'd request you, now it's time for you to enjoy much more, because it's going to be a social event where many of you could end up as prize winners. A few minutes from Dr. Manveer Singh Walia.
Like vaginal hysterectomies. He has been trained from All India Institute of Medical Sciences. Dr. Hegde, if you can just stand up so that everyone can see you. And if you've got any queries regarding to laparoscopic surgeries, especially in the gynecology, during our dinner time, you can always get in touch with him. And I would also like to thank our marketing team, who has put in a great effort for organizing this show. So, about Tumbe Group, I quote, the vision is to create a better, prosperous world through delivery of products and services that have far-reaching impact on human life across the continents and divergent economic strata. And if you look at the group and how it is progressing and how it is medical research, diagnostics, retail pharmacy, health communication, retail opticals, wellness, nutrition stores, hospitality, real estate, publishing and trading, marketing, distribution. So these are our different companies. About our president, our founder president, Mr. Tumbe Moideen. He's a third generation businessman who had come to UAE with a dream of setting a world-class educational institute. And Fujairah came into existence, and now we have got dental and medical specialty center. About Fujairah, we have got 24/7 services in accident and emergency, clinical lab, delivery services, operating services, radiology. Accident and emergency, we have got Dr. Alhaf with us in cardiology. In dental, we have got Dr. Satish and Dr. Sunsa, and Dr. Shafi, Dr. Heba and Dr. Pramod. General surgery, we have got Dr. Mandal and here, Dr. Hana, Dr. Huda, then Dr. Rebecca, and it is both in English and Arabic. Blends and Brews is a coffee shop.
So more applause. Let's see who is winner. Ladies and awards which are going to be announced, I would appreciate and request if the winners would come personally to collect dinner time. It's going to be networking time, and as Dr. Manveer Singh Walia said, it's going to be an interactive session amongst each other. And while I thank the dignitaries, Dr. Manveer Singh Walia, Dr. Satyanarayana and Dr. Vilas for doing these honors, may I request Dr. Satish please come on stage and propose a formal vote of thanks.
Good evening. Thank you, Mr. Ravi. At the very onset, on behalf of GMC Hospital Fujairah, I would like to thank on our founder president, Mr. Tumbe Moideen, for all his encouragement and support he has given to us. Our sincere thanks to Mr. Akbar Moideen Tumbe, Director of our Healthcare Operations, for his active support to all our activities. We would like to thank Dr. Manveer Singh Walia, who always stands us in all our endeavors. Thank you, Dr. Manveer, for being us in this session evening. We wish to thank all our speakers of this evening, especially Dr. T.K. Menon, Director of Administration of GMC Ajman and Fujairah, for being with us today. Our sincere thanks to our Chief of Medical Staff, Dr. Satya, for being the pillar of support for us. Thanks to all the doctors from the region who are with us this evening to celebrate our Doctors' Meet of 2030. We thank each one of you for your encouraging support to this hospital. Thanks to all the companies and the sponsors for the support. Last but not the least, we thank the GMU and the Tumbe Group team for the great support to make this evening a great success. Thank you all once again and see you all next year. Good night.
Hello.